Welcome, everybody, to today's Facebook Live. Welcome back. We appreciate seeing everyone. Today's guest is Dr. Molly Maloof. She is a MD physician, entrepreneur, and she has a startup. So welcome, Molly. Thank you so much for joining us.
Thank you for having me.
That's exciting. So before we even get started about how you found us, I would love to hear about, you're a physician, you have a
Sure.
startup. What's going
Yeah.
on?
So I'm a medical doctor by training, and I've been very interested in the last decade around not just disease fixing, but also optimizing health. So I've been studying the science of health span extension as well as longevity. And I built a medical practice starting in Silicon Valley, and then I ended up moving to Wyoming recently. And so I'm licensed in California and Wyoming, and I also have built like a media brand over the last decade. So I have my own company. I wrote a book called The Spark Factor, published by Harper Wave last year, and it's all about biohacking more energy for women. And then I also have a company called Adamo. And one of the reasons why I was attracted to Clear Passage was because I had not really understood or learned much about pelvic floor health in my education. And my company is a sexual wellness company that has developed a new sex therapy designed to actually help men and women learn really how their pelvic floor works as part of their sexual health. And our sex therapy really does teach people about how to have a healthier experience in their sex lives and their relationships. So I was really amazed at Clear Passage when one of my friends, who's actually in fact visiting me, her name is Katrine Valinsky, she basically, I told her, look, like I'm going to be 40. I haven't had kids yet. I really want to do anything that I can to optimize fertility. And she's like, well, you got to check out Clear Passage. And so the reasons why I checked it out were kind of threefold. One was I wanted to understand, really hands-on pelvic floor work. I really want to understand, like, the health of the pelvic floor. And I also wanted to understand, how can this play a role in optimizing fertility? And then also what I didn't expect was its role in optimizing just gastrointestinal health. So, I see a lot of SIBO in my practice, and I do have people who've had hysterectomies and had different surgeries. I have patients with like, tailbone problems. And I didn't know that there was a manual somatic therapeutic solution that existed like Clear Passage. And so before I prescribe things to my clientele, I really want to understand what they are like firsthand. So I came to Dallas, and I really just went through a whole 4-day intensive with one of your therapists, and was able to realize that I actually had a pretty darn healthy pelvic floor, but there was a lot more immobility in my gut than I realized. I'd had a lot of gut inflammation in the past, had dealt with gut issues for my entire life. And it really was a wake up call for me, because I've done a lot of, deep tissue work on my extremities, and a lot of sports massage and a lot of body work, and even Rolfing twice. But I'd never had anything remotely as deep tissue around my pelvis or my abdomen as Clear Passage. And, I've had SIBO before. I haven't had any abdominal surgeries, but I've certainly dealt with abdominal inflammation. I've had, like a lot of women have had pelvic infections on occasion. And those things take their toll. We forget that there's consequences to these problems that we experience. And I really feel like everyone should at least, I really think that Clear Passage is mostly, when people go to it, they go to it for problems. But I think that more people would benefit from it if they realized that it was beneficial for just optimizing, your gastrointestinal health and optimizing your pelvic floor health. And I just felt like there's a lot of emotion, there's a lot of pain that people store in their abdomens and in their pelvis, and over time this can lead to pathology. And I think we forget that these are areas that don't get touched very often, and it's really important that we develop like a healthy relationship to our fascia. And fascial health is something that most doctors don't even think about, because it's really taught to us doctors as inert tissue, and it's taught to us that it's not, alive. And I really disagree with that. And I really believe in the theory that, voltage is healing, and this is Jeffrey Tennett's work, and that our fascia along with our muscle are, it's a big semiconductor fiber optic network, and it helps transmit, information and energy. And that's maybe theoretical, but that's kind of the marrying of the Eastern and the Western tradition, which is not largely accepted as medical theory today. But I Yeah, so that's part of the reason why I came into Clear Passage is I wanted to optimize my fertility. I had a sonohystogram and it was pretty equivocal. It wasn't like clear whether or not it was, whether there was blockages or not. But I figured, you know what, Clear Passage can't hurt me. So I might as well go try it. And it was like, honestly, I really feel like if there were Clear Passage centers all over the country and people knew how great it felt to have those adhesions broken down and had to have someone go in to your have someone go into your, viscera with their hands in a very, I mean, my therapist was so gentle and yet she was so firm. And like there were some moments that were very painful, but it wasn't the kind of pain that I couldn't endure. It was the kind of pain where I knew something was changing and I knew that there was a opening happening in my body, allowing more energy and blood flow to enter. And it felt like after the week was over, it was like I really felt like I'd experienced like a rejuvenative experience. It wasn't just like, potentially opening up fallopian tubes or helping clear adhesions, but it was really like a therapeutic experience emotionally as well as physically.
Wow. Wow, wow, wow. That's just amazing. First, amazing to hear about your journey, and
Yeah.
then phenomenal. So, in just a minute, you're going to tell us a little bit more. But if our viewers have any questions, please put them in the chat
Yeah,
box.
please do.
Questions for Dr. Molly or myself, and we would love to answer any of those for you. Molly was talking about how she had 4 days intensive in
Dallas.
Dallas. We typically treat for 5 hours or 5 days, 4
Yeah.
hours a day, 5 days a week, but sometimes we can do 5 hours over 4 days, or even if there's other issues and you need us to
Yeah.
treat a little longer, treat a little shorter, we can work around all of that. Something else that Dr. Molly was talking about was just how general overall health is so improved. The abdominal health, the pelvic floor health,
Yeah.
infertility. We have research on just how well Clear Passage helps with overall fertility across the board.
Totally. I
So,
mean, the other thing that I noticed was just like increased arousal. Like post Clear Passage, I noticed an improvement in arousal, an improvement in lubrication. Just noticing that there was, a lot better digestion, which is kind of surprising. It was really cool to experience all of these improvements over time and to feel like, I mean, there's like my mom has had, abdominal surgeries and like some of my clients have had abdominal surgeries and pelvic surgeries. And I just feel like I wonder how much, if we were actually to be able to relieve the tension in our bodies and our abdomens and our pelvis before it becomes disease, like how much that might even help people. And I don't think a lot of people think about, most people go to the masseuse when they're having pain or tension, but I typically try to go to the masseuse for just general stress management, for just optimizing my body's function. And, of course, I go to get a masseuse more often if I'm having pain or any tension in my body. But I look at massage and even rolfing as like, when I did rolfing, it was really surprising how much it improved my posture. So there's a lot that can be done without surgery, that can really give our bodies the opportunity to heal themselves. And I think that's what's really cool about Clear Passage is that it's a very different approach to, I mean, if you actually look at the rates of, for example, women who do have blocked tubes, there's actually better rates of pregnancy than women who go and get surgery to unblock the tubes. And I mean,
yes.
that's pretty surprising, And the thing that I think a lot of women forget as they turn 40 and they haven't had kids yet is like, you might be carrying, I had discovered that I had ureaplasma at one point, and most doctors are not checking for ureaplasma, and they're not checking for mycoplasma hominis. They're not checking for some of these intracellular infections of the vagina and the uterus, and like they're not looking at these because they're considered commensal organisms. They're considered to be non-pathogenic. But I have seen plenty of people in my practice who have actually had actual symptoms from these infections. And so in some people they're non-pathogenic, in other people they actually do have some influence on fertility and infertility. And so because most doctors aren't checking for these things, because they're not considered to be disease oriented, like there's a very different like sort of worldview you have to adopt around pelvic floor health. It's like, first of all, you need to acknowledge that one person's immune system is going to be different than another person's immune system. So something that actually is non-pathogenic in a healthy immune system might be pathogenic in another person's unhealthy immune system. And then on top of that, there's quite a lot of trauma in the world. And I think there's a lot more undiagnosed, or I guess not undiagnosed, but unresolved sexual trauma in the world than there is resolved. And I think a lot of women don't even know how to approach dealing with sexual trauma. And I think that there's a lot of, unresolved traumatic experiences. The body does keep the score. And so you can develop pain and constrictions and vaginismus and dyspareunia solely from sexual trauma or even birth trauma. I mean, a lot of women go through birth and develop vaginismus because they've had such a traumatic experience with birth that their pelvic floor is almost it's typically under, obviously there's a lot of autonomic control, but there's also a lot of somatic control that your body actually does have the ability to flex and contract your pelvic floor. But there's also a deep connection to the autonomic nervous system.
And so you've said a couple of things so far about first, you said you've had Rolfing a couple of times. I would like you to compare, because I've had clients and patients and potential patients ask me, well, how is this different? I've had Rolfing, I've had PT, I've had pelvic floor, and I can give them my litany, but I would love to hear how you find it was different.
Yeah.
And then two, you were talking about, all of these sub-infections.
Mm-hmm.
Like you said, as we can get in there and break apart all of that tissue, letting it become more mobile again, but also releasing maybe some of these old infections so your body can go ahead and take care of them also. But so if you could go ahead and first talk about how this is different than all these things that you've tried, and then how clear passage you feel could help with all of these different pathologies that we are talking about, that I think a majority of us women have.
For sure. So Rolfing is basically a very deep tissue, and really it's a type of manual therapy. It's really different than body work, because when you go into Rolfing has a very specific methodology in terms of how it approaches the body. So it's approaching the body in three-dimensional space and specifically trying to help a person basically return their musculature and their fascia back into optimal alignment for functionality. And that involves very deep movements that are very slow. And they're designed, it's unlike when you go to massage with loop, like with a lot of oil, for example. The intention behind Rolfing is not to have like a comfortable experience. It's actually quite the opposite. But in my opinion, I have a very high pain tolerance. And so I found Rolfing to be incredibly relaxing and therapeutic. But I also kind of enjoyed the pain of it because I had such an endorphin rush from the intensity of the movements. Like, it's very slow, it's very deep, and it's not meant to be just working on the muscle. It's meant to be working on the fascia. And
but clear passage is nowhere near that type of pain intensity.
I mean, there was a few moments in my abdomen that were very high intensity, but I was also, I was never, I'm not the one. I'm actually like, my therapist was like, you can tell me if it's too much. And I was like, I actually don't have a too much button at this point. Like, I can handle a 9 out of 10. And I think a lot of people would probably have said something to their therapist, which is totally normal. But I was specifically aiming to have all the adhesions broken apart as fast as possible. So I think that so there was maybe at the very end of my session, a few maneuvers that were along the lines of Rolfing. But Rolfing is also over the course of 10 weeks. And it's like once a week, and you're doing every different body system. They don't really do much of the abdomen, if I remember. I don't remember a lot of abdominal work. Some abdominal work on the psoas, but they don't go deep into the pelvis. And they do a lot of facial work and craniofacial work. And there was actually a surprising amount of craniosacral work as part of my experience at Clear Passage, which I found deeply relaxing and exactly what I needed at the time. Yep. However, there was a emphasis on slow, deep, very deep holds. And literally, the therapist was aiming to find places of resistance and then let the resistance almost give way. Um, and there, I just, I kind of did what I was doing during Rolfing, which was just breathing deeply into it. And none of it was unbearable. Like, I thought most of it was actually very pleasant. And I also learned about how to, work on my own connective tissue. I got some cool handheld devices. I was taught about how to do my own rolling and just really how to make it more of a habit, which I actually have not done much of afterwards, which is a problem, but I'm going to. And then the other thing is the fertility piece. So, when you're young and you haven't had many sexual partners and you're in your early 20s, maybe you're just starting out in dating, your body is a younger phase. You have a lot more fertility because you're younger, you have more eggs, you have higher hormones. Like, it's a different phase. When you start hitting 40, you start losing egg quality and quantity. And you also have had perhaps a sex life for 20 years. And so a lot of people have unresolved pelvic infections that they've never even been diagnosed. And what's really cool is there's companies like Seed that are developing vaginal probiotics. One of the things that I learned when I was in medical school was like how certain, like for example, group B strep had to be taken care of before a baby was born. Torch infections had to be evaluated before a baby was born. You didn't want to have a baby born to a mother that had these infections because it compromises the child, especially as the baby's being born through the vagina. So optimizing vaginal health and pelvic floor health is not common practice in medicine. It's not even discussed in medical school. And so I have learned almost everything I know about pelvic floor health and sexual health in the last 3 years because I founded a company called Adamo. And as part of the original part of our what we did, we started out as a pharmaceutical company developing drugs for sexual dysfunction. But then we realized that the time horizon for that was going to take too long. So we moved and pivoted to just developing a sex therapy program. So we're basically one of the biggest innovations in sex therapy since Masters and Johnson. And as I was developing this methodology with Aaron, Michael, and Saida Desolé, who are two world-class sex therapists, I realized that there was a big area of knowledge I had not really understood, which was I did not know about pelvic floor anatomy. I had dissected the pelvic floor. I had taken anatomy classes, but I did not understand the functional anatomy of my pelvic floor, I didn't understand the pleasure anatomy of my body. I didn't understand even how big the clitoris was until 3 years ago. Like, the clitoris is a pretty large organ in comparison to what we think it is. And it wasn't properly mapped by anatomists until I think 2007. And so it's actually it's very, very new knowledge of actually how a female pelvic anatomy functions. So there's a huge movement happening around pelvic floor health and optimization. There's a whole movement of doulas teaching women about how birth can be a actually pleasurable experience, how you can actually have how birth can be taught to be not so frightening, how birth can actually be about letting contractions come and go and not actually pushing, but just enabling them to happen as they naturally do. So there's a lot of changes happening to our understanding of feminine health because, frankly, women are rising in society. Women are having greater economic freedom. And with that comes an investment in new products and services around female health. So I'm actually so excited to be a part of this movement of female health and female sexual health optimization, because I think we're on the precipice of a huge paradigm shift in the way that we think about our lives. Like, we have for too long basically been experiencing medicine that was really designed for men. And, when it comes to our bodies as women, we often forget to give them the kind of attention that they really deserve. Like, women.
And that's something that we do at Clear Passage. We treat so many females.
Totally.
Yes, we treat now our bowel obstructions. We do obviously treat men, but yeah. female infertility. And you are absolutely right. Then coming in and taking responsibility for that health and feeling better. Talk to me about. So first of all, you have referred a couple people over to us already. I've been doing the medical reform, so thank you very much. So you are talking and you're preaching what you are talking about. Thank you. when people come up to you either about your practice or about Clear Passage, any practice, and say, hey, you know what, my insurance isn't going to pay for that. It's not going to pay for Clear Passage. It's not going to pay for the specialized test
Yeah.
that you're going for. It's not going to pay for just some of these more out of the box
Yeah.
ideas that really, really help, but they're just not
They're
covered.
not just considered coverage because the healthcare system isn't designed. Sorry to interrupt you, but the healthcare system isn't designed to optimize health. It's designed to bill for sickness and disease. But the thing is, it's also not designed for long-term care. Medicare and Medicaid are designed to keep you in the system. Our healthcare system, people are bouncing around insurance companies every 5 years. So they're not really invested in your recovery of your surgery. They're not really invested in your fertility.
And
Like,
that's really, really important to say again. Healthcare
yes,
companies are not invested in your health,
they're
right?
not. They're
They're
invested
not
in your
going to be
disease.
paying for, yes,
They will pay
exactly.
for your surgery to remove your appendix, but they will not pay for the SIBO that results from ileocecal valve dysfunction. You know, my mom has dealt with all sorts of problems with her gut post like partial colectomy, and she's fortunately been able to recover. She only had she was able to recover function, but the healthcare system wants you in and out to treat the disease and then to move on, and there's a lot of healing that happens after you leave the hospital. I mean, the thing that I hear from so many mothers is I had my baby and then no one cared about me after that. There's no postpartum care. It's all about the baby after that. We have an entire system for taking care of a child after a baby's been born. But the woman, I mean, I've had girlfriends have babies and their entire hormones are suppressed. I'm talking estrogen, progesterone, testosterone, all flatlined. And it wasn't until she complained to a functional doctor who did proper testing that she was able to see, oh my God. I mean, hormones are barely even checked by most doctors. And it's not even considered for a woman to have, like low testosterone, for example, is not even a diagnosis for most women. And it's not even considered standard treatment to replace testosterone, which means a lot of women are walking around with low testosterone in their perimenopause and menopausal states, having terrible sex lives because the doctor isn't checking for these things. So
Right.
you
And
have
we've
got
got
to
a
take,
C-section, right? And the
yes,
C-section affects the
the
pain. We see so many
C-sections,
C-section pain.
the episiotomies.
Yes,
I mean, these
yes,
women are going through these massive physiological change. And then they're just, okay, goodbye. And oh, by the way, bring the baby back in a week. And it's like there's no care for women postpartum. And it's really a shame because women's bodies are so delicate during that year after they've had a baby. I mean, they are literally experiencing so many changes to their physiology after that year and to their brain. And I mean, the thing I would try to explain to people about Clear Passage is yes, it's expensive. Yes, it was a really big expense for me. I mean, I'm not telling you that like it was cheap because it's not, but it's also equivalent to getting hours and hours and hours of therapeutic manual therapy in 4 days. So I have to say it was incredibly like I mean, I did do work on part of the days when I came home, but I was pretty tired. Even though I was laying on like a table every day, I was pretty wiped out because I really felt like there was a lot of physical changes happening and a lot of emotional processing happening. And, it really was incredibly therapeutic just as an experience, but also I got incredibly good rest that week. I mean, I needed to rest. I had been pushing my body for literally 2 months of travel, and I have three companies. I mean, I'm a busy lady.
yes,
And
you are.
so it was a gift. I mean, it was a real gift that I gave myself because I was like, look, if I want to have kids, if I want to have a healthy gut, if I want to have a healthy pelvic floor, I'm going to give myself this opportunity to optimize this part of my body and to create the conditions for better fertility, to create the conditions for better gut health, and to actually understand my body better. Because I didn't really understand my pelvic anatomy like I do now. Like, I really felt like because it wasn't like, by the way, none of this was like sexually arousing, but it was definitely a new relationship to my vagina and my pelvic floor and my cervix, and a new relationship to my uterus, a new relationship to my fallopian tubes. I actually figured out where they were in my body. How could I feel them? Like, I had a better relationship to just how my pelvic floor even functioned. And
Right.
that
How
is
was
something that,
Jenny with the education?
oh my
Obviously, you're
God.
learning.
I mean,
Yes. Tell us about the
the
education.
education was out of this world. I mean, literally, you're learning about your body in a way that's literally hands-on. It's not about reading it. It's not like there's nothing that replaces hands-on experience. And in fact, I think that with all these changes happening in AI in the world, I really do believe that like the hands-on therapies in medicine are actually going to experience a hopefully expansion in the next decade, because a robot cannot do this. Like this is a human to human experience that is very, 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 very therapeutic, and it requires a level of trust. And because Jenny did such an incredible job at educating me, I never once felt uncomfortable. I never once felt strange. I was even finishing my period during the experience, which sounds kind of gross, but she didn't make me feel gross at all. Like it was honestly a better experience than any OBGYN experience I've ever had. Like I've never had an OBGYN experience that was this careful and sensitive with my body, that it made me have a new relationship to my body. I was like, wow, I need to actually take much better care of my body. And I'm a professional biohacker, but I really felt like it was me giving myself this really like new understanding of my organ systems from literally direct touch. She was like, we're moving into, your liver right now, and we're by your gallbladder, and we're by your lower intestines. And I mean, I really felt like it was a direct experience with my anatomy and physiology that was awesome. I mean, it was really great. And I think most women would love to have like 4 hours a day to themselves, just to lay and just to relax and to think. And so, it was incredibly relaxing in general. Like imagine you're getting to lay down and have craniosacral and have physical touch on your body in parts of yourself that have never really been therapeutically manipulated. And it's kind of like wow, I think I should do this like every decade or like every
Right.
5 years.
Well, because I keep telling people it's almost like a retreat, and you said that so
It is.
well.
Yeah.
You're away from your home. You're in now I use the word spa-like room, and
It is spa-like, actually.
some of my therapists flack at me. It's not spa-like. We're treating as physical therapists, but you're in a darkened
there's
room,
music,
low lighting. We got
clean,
nice
there's low
music going
lighting.
on. It's decorated beautifully. And then you have just this one-on-one contact with your therapist for 4 hours, where you are the center of attention.
Yep.
And so there is no treatment that is like yours, because you are a unique individual. So it's pulling that thread. So when Dr. Molly was saying, oh, we're up by the liver, now we're over by the gallbladder, it's because Jenny was following this thread of, okay, I'm feeling a pull here, we're doing adhesion here, oh, she's got an emotion stuck over here.
Yeah.
And she just keeps following it. So that's what's really nice, is that you have so much awareness of your body and what's going on, that you could appreciate everything that we put into therapy.
I mean, keep in mind, I'm pretty advanced. I have a lot of interoception. I have developed the ability to sense myself from the inside out. I can tell maybe my blood sugar right now after lunch is probably around 110, 115, probably maybe max 120. And like, I've been tracking my biomarkers for a decade, and more than that, actually, probably more like 12 years. And so I have a lot of understanding about my body. And I even got an MRI once from Fornuvo. And I said, will you please look at my uterus one more time? I think you're missing something. And they were like, oh, yeah, you have a small fibroid. I'm like, I knew it. And I was waiting for you to tell me that, because I was pretty sure I have a fibroid. And they had missed it. I mean, I had known there was something there. So I mean, I've done neurohacking, I've done biohacking, I've done blood sugar hacking, I'm working on stress hacking right now, circadian rhythms, I mean, physiology. I mean, I've done a lot of different things. I've had trainers, and there's nothing quite like this aside from what I would say is Rolfing. But Rolfing is really designed for posture, for fitness. It's not really designed for, I mean, I guess you could use it for injuries, but I would not necessarily think of Rolfing first line for like an injury or for like a post-surgical care. Like this is something that there's kind of two ways to think about clear passage. There's, have I had surgery? Have I had problems with tube blockages? Have I had tailbone problems? Do I need to actually remove adhesions from my body? That's one piece of the puzzle. And then the other piece is like, I am getting older, and my body needs to be in full alignment. Like I might have developed, maybe I've had stomach infections and pelvic infections, and I know that there's some residual inflammation left over from perhaps even emotional pain. And I want to just optimize my abdominal function and my pelvic floor function and my fertility. So it's really two categories. It's like someone who has actual pathology and wants to fix it, which is why most people will probably go to Clear Passage. And then some people might go just for the therapeutic benefits of feeling like you have an improvement in your sexual function, feeling like you have an improvement in your digestion. Maybe you've had SIBO for a long time and you're sick of it. Like that's a way to think about it, is like both disease fixing, but also optimizing a physical function.
I think in general, and probably why you are doing so well and naturopaths are doing well and functional medicine doctors are doing so well, is that people in general are really starting to take control of their health.
Yeah.
And realizing that, hey, I need to go see Dr. Molly or someone like her, or I need to go to Clear Passage for, like you said, optimizing pelvic floor health, optimizing digestion, optimizing fertility.
Yeah.
So I think just people are, I believe, tell me if I'm wrong, but I really think there's this shift where people are really starting to invest in themselves. And that's really what it is.
I think it's happening. And
yes,
I think it's a shame that
like 30 years ago, my husband would say, if you ain't happy, ain't nobody happy. And so I would go get treatment every other week, which is unheard of for a young woman, right? You pay out of pocket and, but it truly makes a difference. If I want to be somebody who's giving all the time, and Molly and I are in healthcare, so we're giving all the time, but then we have children and all that other stuff too. If you want to be giving all the time, you have to be optimal yourself.
You sure do. Yep, yeah. I agree. And, I think if you are a really hard driving person who works themselves into the ground on occasion, you're going to need more tune-ups.
That's not you.
You're going to need more tune-ups, And so, look, I invest a lot more in my health than the average person, but it's because I have literally 3 businesses in the health space. Both, my brand promotes health products, and I also do education. I taught at Stanford. I wrote a book. I have my company Adamo. We just launched this new sex therapy, and one of the big channels we're going to be marketing it through is pelvic floor therapists, because it's one thing to actually get a pelvic floor assessment and practices it with a pelvic floor therapist. It's another thing to actually apply it in your sex life. And that's not currently taught to people, is like how to have a healthy sexual relationship with your body. And so what I've learned is that there's a lot of women who experience a lot of pain during sex. And part of it is because they actually don't know how their pelvic floor works. They don't know how their brain can actually play a role in the function of their arousal. And they don't have a relationship to their pelvic floor because they've never been taught it, And so I'm starting to recommend pelvic floor PT more often, because I think it's really important if you are experiencing difficulties in your sex life. There's enormous amounts of sexual dysfunction. So a lot of sexual dissatisfaction in the world. And I think there's a lot of ways that you need to look at this problem space. You need to look at the actual functional anatomy. So Clear Passage is great for that. But you also have to look at your hormones and your blood sugar and your overall physical health, your thyroid. And then you also need to look at your relationship to yourself and your partner and how you're having sex. And so a lot of people that don't actually know how to have really wonderful sex with their partner because they've never been taught. And what they've been taught has been basically perpetuated through, frankly, pornography or what people see in movies, which isn't really what great sex looks like. And so we have developed a protocol that's really takes what Masterson Johnson did with sensate therapy, and it goes beyond that. It actually brings people. So sensate therapy really was about mindfulness-based sensual touch. It's fantastic for building libido and dealing with desire discrepancies. It's fantastic for people who are struggling with performance anxiety around sexual contact. But Masterson Johnson did not believe that sex could be taught. They thought that sex was a natural function. And at Adamo, we've basically figured out how to teach a therapeutic method that involves understanding the pelvic floor and how do you breathe with your pelvic floor and how do you actually generate more energy and blood flow to your pelvic floor using your mind pelvic floor connection. And I think that Clear Passage would work phenomenally well with the Adamo method, because it's almost like you get the physical therapy that you need to deal with the problems of the pelvic floor, but then you actually learn how to use it in real time with your partner. So I think if everybody had better pelvic floor health, we'd have way better births. We'd have a lot less birth trauma. We'd have way better sex lives. And we'd really be closing the pleasure gap between men and women.
Right, right. So if you are interested in more about Dr. Molly Maloof's organization, her link is in our chat. It's livingadamo.com.
Correct.
Make sure you click on that. You can always get a hold of her. You've talked about just partnering and we need more clear passages. Just FYI, we do have a franchise system out there. So if anybody wants to buy a franchise and start putting them up all over the place, we're working on that. But in closing, if there is somebody that is thinking about clear passage and you have any words of advice for them, what would you tell them, Dr. Molly?
I apologize for the background noise. I'm having a window replaced right now. I would tell people that have a long conversation with one of the staff at Clear Passage because they will be able to answer all your questions. I had a lot of questions ahead of time, and I think having those questions answered really made it an easier decision for me to go through with the full methodology.
Wonderful. Thank you so much for your time. If you're interested in anything about Clear Passage, call us today at 352-336-1433 or hop on our website, clearpassage.com. We have locations in Florida, New York, St. Louis, Dallas, Reno, and London. So thank you so much, Molly. We look forward to working with you.
Thank you so much. I appreciate you.